Welcome to today's webinar. This webinar is designed for our HIV practitioner audience and other healthcare professionals who are actively involved in COVID-19 response. We would like to welcome our presenters, Dr. Stephen Safren and Deborah Jones-Weiss from the University of Florida, who will go over how to manage stress while providing clinical care during the COVID-19 pandemic. Welcome.
Good evening, everybody. Thank you for joining us. My name is Steve Safren, and after I finish my part of it, we will be joined by Dr. Deborah Jones-Weiss. We are actually from University of Miami in Florida, and I just have a few housekeeping things to go over at the beginning. So the first, as you see on this slide, IAS-USA will designate this live activity for a maximum of 1 CME credit hour. For this slide is about nursing and pharmacy credits, which also you can get a 1 nursing or pharmacy credit hour for this. That this webinar is funded by IAS-USA. And the way that it's going to work is the first part is going to be basically a webinar with slides. And then the second part will be Dr. Jones-Weiss and I having a conversation based on the questions that people type in. I see someone just chatted that they're not hearing anything, so I wanted to make sure Jose, that others are hearing me, or Deborah, are you hearing me? Because I can see you. Okay, so it might just be one person doesn't have their sound on. The first part of this, I will be going over slides on managing stress during this difficult time and while you're providing care to clinical patients. And then, like I was saying, we will be having a discussion based on the question and answers, both on questions that are asked during the session. So please use the chat box that you see on your screen to type a question at any time. And we also have some questions that people put in before that we can discuss once we get to that point. So again, this is on well-being during the COVID-19 crisis for healthcare practitioners, which is a really important topic, not just in terms of managing your own anxiety or emotions during such an unprecedented time, but also to make it that it's easier for you and that you're providing more effective care to patients that are dealing with this. So learning objectives are to, at the end, you'll hopefully be able to describe detrimental effects of transitioning from acute stress reactions to chronic stress reactions. I'll be going over that during difficult times. We will hopefully have you be able to describe 3 overarching waves, 1 being unplug and anchor, 2 being charge up, and 3 being of service, which hopefully will help build resilience and mitigate the effects of pandemic stress on emotional health. And then also, maybe most importantly, identify techniques to prevent burnout and other negative reactions to acute and severe stress during this time. So the components of the discussion, like I mentioned, are why is it important to build resilience to this during this time? How do we begin to do that? And again, use the chat box at the right of your screen so that then we can hopefully have a productive and active conversation, kind of like the Car Talk radio show where people call in questions and we will answer them. And then at the end, Dr. Jones-Weiss will do a brief guided meditation. And I have some thank yous to people that helped with the content of this, including Dr. Deborah Kaysen at Stanford, who is the president of the International Society for Traumatic Stress, Michelle Jacobo, who's a psychologist at Dana-Farber at Harvard, Luana Marquez, who's a psychologist at Harvard, and the team at the Columbia HIV Center. We've been sharing materials to try to make it that we all have similar content that we'll be presenting. So the first question, why build resilience now? You're all across the country, different places might be at different times. So if we see on the right side of the screen, let me see, I got the pointer working, that you may be in a period of pre-trauma stress when you might not have full hospital units or you might not be at the peak of what might be happening. You may be an area where you are in a peak traumatic stressful period with COVID-19, or you may be coming down and hopefully will soon be coming down from it and looking back, which could be a post-trauma stress time. No matter where you are in this, it's important to build resilience. On this second graph, what we see is a first wave of patients coming in with mortality and morbidity going down, potentially a second wave after that. But then once it does resolve, there may be a wave of non-urgent, non-COVID medical conditions that need to be treated, other chronic diseases that might have gotten worse. And then what we're talking about here for both providers and for patients, a wave of dealing with potentially the aftermath or the during math, depression, post-traumatic stress reactions, traumatic injury, and things like that. And we want to build resilience to this. We want to help you with skills that you can utilize, skills that are proven, that are evidence-based, that really help reduce this kind of mental health negative reaction to the distress that you might be experiencing or potentially experiencing in the future. Now, one thing to remember about all of this is that anxiety is normal. If you're feeling anxious or upset, but particularly anxiety is sometimes even adaptive. For example, on this graph, you see this level of pressure. We call it the optimal level of anxiety. If you have too little pressure or arousal, you might be bored. You might not be motivated. But then you have this ideal zone where you have like the right amount of potential either anxiety or stress or even pressure to do something where you're jazzed and you're pumped and you're doing the work that you need to do. But then when anxiety is too much, you see strain or burnout where it's just you can't work or function. And what happens with stress is that, again, it's a natural reaction that, it's called the fight or flight reaction, where the body prepares itself to defend. Evolutionarily, we've always had that, if you're about to be attacked, you want to mobilize the resources in your body, whether it's increased heartbeat, different kinds of visceral reactions, you're pumped, your anxiety is there, and you need to just react quickly without necessarily thinking things through. But you need to quickly fight or flight. You don't want your brain to slowly be saying, oh, there is a car coming at me. Let me decide what I am going to do. Should I jump? Should I run? No, you want this anxiety reaction to come in so you can quickly act and not necessarily think things through. Again, just to kind of separate those two reactions, this slide here is like talking about your brain under normal conditions when you're not necessarily stressed out or having that fight or flight reaction. You observe things, you input, you interpret, you process, you evaluate the options, you plan, and you act. But, as I was just talking about, if your alarm system, if your anxiety is activated, or that fight or flight response is activated, what happens is the alarm system goes what we call the express route, and you don't process, you don't evaluate, and you don't plan. And in this situation, what we want to avoid is transitioning from what we call acute stress, kind of like as soon as the stressor happens, to chronic stress, and chronic stress can be much less healthy. Acute stress are valid feelings of fear and anxiety during this challenging time, but then as it continues or as it's not a discrete event, we want to look at how to do adaptive and effective coping to build resilience to all of this. So some of the 3 key ways, which I mentioned during the objectives, and a lot of what we'll talk about is somehow related to these key ways to build resilience and mitigate that sustained fight or flight reaction, the transition from acute to chronic stress, are 1, unplug and anchor. So thinking about ways to do that, such as making sure you have social support, interacting with friends creatively with social distancing, interacting with family in a way that's positive, scheduling pleasurable activities. That is something that is really important during stressful times or during times when you're constantly potentially needing to work or be dealing with negative things, is to find during the day or on the weekends or when you're off, to really find to make sure that you're taking some time during the day, that you're engaged in activities that you either find pleasurable or activities that make you feel good about yourself, that you feel competent, or what we call mastery events, and that you actively schedule them during the day. Do meditation or relaxation, combat excessive negative thinking, which I'll talk about in a bit. And then, the basics, charge up. Make sure that you're taking care of your eating, making sure that you're taking care of your sleep. Exercise really helps with mental health and your immune system even. And then be of service is the 3rd thing, but you're doing that. If you're a provider in this, you're being of service, and take some time to actively feel proud of your accomplishments and your work during this time. And also using effective problem solving for when that's the most relevant and the problem can be solved. So going back to this unplug and anchor with respect to social support, there are very many different kinds of social support. Here's 9 of those types, but thinking through, making sure that you have the different components of it, whether it's support for your needs, whether it's emotional support, whether it's a social connection, feeling needed, reassurance, whether reliable social support. Sometimes social support can come in the form of advice and information or physical assistance or even material assistance. So during this time, looking at a slide like this, which we'll provide afterwards, making sure that for those particularly 9 types of social support, that you have that available to you as you need it, and that you have people for that, and looking to try to find people that you can look to provide those social support needs. The other thing, like I mentioned, we call it behavioral activation, making sure that you schedule events or activities that produce a feeling of mastery or pleasure every day. Even if you're working that day, it could be something short, but it could be taking a break to just listen to a song that you like, playing with kids if you have kids, looking at a hobby if you can bake something or cook something, finding, your favorite Netflix, TV show, movie, or book, or hobbies that you can do in your home. But again, it's one of those times where you have to, when you're stressed, you don't think to do this, but to make sure that you're spending some time during the day where, in terms of unplugging and anchoring, you're taking a break from everything, even though things are difficult right now, but taking a break from it and trying to get your whole fight or flight mechanism system that I mentioned, or limbic system, kind of calmed down. Another way is through recharging and unplugging. So when I say recharging, there are a lot, if you go online, of relaxation exercises and recordings that you can find online, or apps. We have a few that we list at the end. Mindfulness is maybe something that you've heard about. It's a type of activity similar to meditation where you try to make sure that you are taking stock of the present moment and being non-judgmentally aware of that present moment. Mindfulness is defined as non-judgmental awareness of the present moment. Deep breathing, learning how to do that, breathing all the way down to your stomach, making sure that and that's something that you can do even at work. If you take like a 15-second break, is just take 3 deep 6-second breaths, inhaling and relaxing, and just taking that to calm your limbic system. Other things like exercise, yoga, certainly. Take breaks at work. And that's just really important, even if you're going from patient to patient to patient. But if you can take with an alarm on your phone or watch where it would have you even take a 30-second break in the bathroom, just in a place by yourself to do some deep breaths, just to recharge and calm that limbic system. I already mentioned distraction, using humor as much as you can, and then things like for problem solving, like keeping a schedule and, seeking mental health mental health help if the distress or impairment is too high. So just like any other problem or medical problem, mental health problems can certainly be distressing and impairing, and it is not a weakness. People we hear questions and comments like that feeling like mental illness or needing help with things like depression or anxiety would mean that you're weak. But no, it is, there are many reasons that someone might get to the point of being too distressed or having their distress impair their work or their family or other parts of their life. And utilize what resources you have either at your workplace or through a referral to a mental health provider if you get to that point. We also talk about unplugging. So limit the consumption of the news. You could just be listening to it all the time and it just is point of no return and you're not really getting more information, you're just getting worked up. So limit that, certainly not before bed necessarily. And take frequent breaks. I already mentioned that a few times, like while you're at work. The title of this talk is Finding the Middle, and part of that is finding the middle between self-talk and beliefs. So these are some common provider beliefs and natural thoughts that we hear, and we want to kind of turn these down, or turn the volume down on them. So things like, I must be strong at all times, it is my oath and duty to do everything to help. These are things to watch out for, like if you're having thoughts like this. I need to be the pillar for my family at all times. I need to save everyone. I have to do more. To the other side of, I'm overwhelmed. I'm terrified every time I go into the hospital or work. I can't do this anymore. I can't manage everything. I can't take care of others when I'm so upset. So we talk about ways to look at these types of negative thoughts. And I have a slide, sorry, coming up on that. But also another thing is finding the middle between acceptance and soothing and problem solving. So when you are having difficult situations, some of them you can problem solve and there are solutions. So when that's the case, we want to go back to that notion that I talked about before of slowing the brain down and making sure that you're doing effective problem solving and following that path of having the correct input and logic. So looking at what are the possible solutions to the problem, what is the best solution, how can I break that down into steps, and is there anything else I can do? Some things that you're going to face might not have a obvious solution or even a solution. And for those, that's where you have to use acceptance-based coping, where you try to soothe yourself. And for that, the pathway is notice your emotions, take stock of how you're feeling, tell yourself it's okay to have these feelings, and engage in self-care. Going back to the slide that I was talking about with self-talk and those negative beliefs and thoughts that to watch out for. With that, we also find the middle between reasonable mind, emotion mind, and wise, and the middle ground there is wise mind. So to get to this, you're going to have the valid emotional components to what's going on, that this is, like I said before, an unprecedented time, and it's really difficult and can be very scary to be taking care of patients with this virus that is so easily spread. And so, there is a very valid emotional component to it. Or guilt. I mean, we've heard a lot from our colleagues and from others doing webinars like this about guilt and, making decisions that they thought were the right ones, but then feeling guilty about it later. And, again, the emotional component is very valid, but then there also is the reasonable component. And how do you slow it down so that you can get to the middle ground there, because there is no exact, robotic, reasonable way either. So the middle ground, you try to take some time to slow down your thinking. Regarding guilt, tell yourself, that's this third bullet point, to look at the situation and look at your intention, and remember that hindsight is certainly 20/20. But also telling yourself, once you've done everything that you can do or could have done, that really is all you can do. And thinking, hey, what would you say to a friend if they were experiencing these thoughts? How would you help them, and what might you say? Those were the introductory slides. So these are some additional resources that we have, and we'll transition to the questions. We're constantly updating our website. We are co-directors of the Center for HIV and Research in Mental Health at Miami, and we are collating materials that might be useful. Someone put a question in about getting the handouts. Those will be on our website as well, if also not through IAS-USA. Sorry, some of these slides are specific to Mass General Psychiatry is also collating a really great resources for folks. There's an app called Headspace, which is available to healthcare workers during the COVID crisis. And we show some other apps here, like a yoga app, a PTSD coach, alcohol or substance use helpline, National Suicide Hotline. We heard about a provider in the news who actually did get to the point of committing suicide. So these things, like I said, can be should be taken seriously. And then also some child-oriented links that hopefully will be useful. And so now we will turn over to some of the questions. Dr. Jones-Weiss, would you lead us in that, please? Oh, I think you're on mute.
Yep, there we go. Thanks for the overview and for discussing really the cognitive behavioral components there. I have a list of questions that people have submitted, as well as some additional ones that have come up most recently. And the first question actually that was submitted was about coping skills in terms of learning how to deal with what's going on right now. And so I just want to actually turn to that one. And that is really, how can we deal with coworkers who are perhaps rude when we provide them with information or we give them instructions. And I want to encourage us to think about everything that happens right now from a perspective of the fact that, as Steve has pointed out, the way that we're feeling and other people are feeling is really a normal reaction to a very, very stressful and frightening situation. In addition, we're all going through this together. So we have to remember that whatever that person is feeling, whatever we're feeling, most of us are feeling very similar. And then the last thing I want to say is that many people have gone through this, and they've gone through it successfully, meaning that they have managed to find their way, and it's also possible for you to find your way. So how do we deal with people who are rude? Well, first of all, that is certainly going to happen. during the course of our interactions with other people. When we get stressed out, and you may be noticing this already, stress can turn into irritability and to frustration that can affect you and make you rude and make also other people seem rude to you. So the way that you perceive people is affected by your own stress and your own frustration as well as by theirs. Remember that when people are rude, when people feel as if they are pushing against you, it's also a kind of coping mechanism, that it's reducing the demands that you're able to put on that person because they push back on you, and they protect themselves in doing that. So how do you deal with that? Well, there are kind of two methods that you would want to consider. One is an active method, so being able to say to the person, I know that this isn't about me, that you're feeling stressed out, and that's why you're talking with me right this way. But as Steve might point out, you might want to wait until that person is calm to have that kind of confrontation or that sort of conversation with them. They might not be ready. You can also remind yourself that the way that this person is communicating with you is not about you, right? It's about the situation. It's about their own experience of stress. Or you might want to use a combination of the two. You might want to recognize that you can speak gently to the person about the way that they're communicating, and you can also remind yourself it's not about you. And that's really, that being able to say to yourself, this isn't about me, is using what Steve would call that wise mind, right? So going for that middle ground. The next question that we had that came in, and I really would like to get you to help me with this one, Steve, and maybe you can even lead this, is a lot of our questions that we have now are about working with others and being leaders. So how to lead during this really difficult time? Some people certainly, as this question person points out, some people are really better at leadership than others. You know who you are, right? But when we have to deal with a difficult situation, how do we do that? And Steve had some good resources. Do you want to talk about that?
Sure, and also just a reminder for the questions that you can use the chat box to type them in real time, and we will address them. But that's the chat everyone box, and then they get moved over to a question area for us. But yeah, people asked about tips for supporting staff who are very anxious. And, you know, I think one thing is to, as Deborah mentioned, like, we're all in this together, and it's important to understand that this is, you know, shared experiences in terms of their reactions, whether it's despair, anxiety, frustration, exhaustion, whatever the emotion is. And I did see some tips. They were from the British Psychological Association, actually, where, you know, some of the things are, first of all, in terms of leadership, to be visible. So guide staff to the resources that they need. Make sure that you know, are looking around and listening and linking people to things as they need them. And also knowing that you don't need to have the solutions all the time. Being able on yourself to know that you may have to tolerate and manage uncertainty, and also making sure that you're taking care of your own well-being so you can take care of your staff. It's like that expression, you know, or like when you go on an airplane and they say, like, put the mask on yourself before helping the person next to you or your child. You know, you're not going to be able to do that if you yourself are struggling with not getting enough oxygen. Having a communication strategy, ensuring consistent access for your staff to have physical safety needs, ensuring the human connection and methods of utilizing, like we were talking about in this, pre-existing peer support, providing psychological care to patients and families, making sure that they have that, normalizing psychological responses, and, you know, delivering, like I mentioned, delivering care the best that you can. One other thing that I would just say, too, in this is that, you know, anxiety is contagious. And if you're in a leadership position, it is important to try to really control your anxiety, and doing that by following some of the tips that we mentioned before, you know, slowing down your thinking, taking, breaks, etc., like looking at your reactions and seeing when you need to do that, because, anxiety is contagious. So the more you're anxious, the more that's going to translate to people below you, I'd say.
Good. Thank you very much. I want to pick the next one here. It's about healthy boundaries, and it says, how can we have healthy boundaries with work during this time? And I can tell you, if there are two people who don't have healthy boundaries, you're looking at them right now. I know that right now we're all feeling like we want to do as much as we possibly can. And a lot of times that looks like taking on way too much. And I'm sure that you all know that if we take on too much, we're really not able to do anything ultimately, because we burn out and we get exhausted. Not only that, but in addition to our work life, we are inclined to perhaps take on additional things when we get home. Perhaps we're sharing parenting. Perhaps we have other duties that we have to pay attention to. So how can we establish some boundaries? I think I want to suggest that the most important thing is to imagine that you're taking your own pulse. When do you start to feel emotionally, physically, as if you're becoming overwhelmed? That's a cue to you that you're taking on too much. At that point, that's your cue that it's time to establish a boundary. It's time to be able to say no. Now, I know in the helping professions, in healthcare, we want to really say yes as much as we can in terms of being there for patients. And Steve and I are both talking to a lot of providers who are taking on more and more, getting text messages from other providers. What do I do with this patient? How do I manage? And feeling kind of overwhelmed. But you know that if you don't draw a boundary for yourself, you won't be able to provide optimal services there. So what you would say to your staff to encourage them to take time out, to encourage them to engage in some self-care, to encourage them to take a break, you need to be able to say to yourself, right? So the answer to this question is, what would you tell someone who's working for you? You would advise them they need to take care of themselves. Do you want to say something, Steve? Do you want to add to that?
I think you really covered it, that, those are certainly the issues that come up with, and yeah, those great points.
So our next question.
We've got the question about approaching grief in this time when family, friends, and coworkers are dying and don't have access to the usual outlets for healthy grieving. And, I think that this is a very serious, also difficult concern that comes up, and it is just such a weird time where, people pass away and you can't go to a funeral, or you can't be together with people for a memorial service or a wake or whatever your normal ritual might be for your religion or your just beliefs. And it's a really difficult time, and it's grief, and there's also something that can make it more complicated, like if it becomes like a traumatic grief type of situation. And how to approach it for yourself, and then also how to approach it for other people is what gets asked, or what was asked about, I believe. So first thing, of course, is to just take a time out, even if it's for a few minutes. But when a death occurs, to acknowledge and honor the person who has been lost. And you can encourage each other to share positive memories about the person, allow others to talk about the death without shutting them down. On the flip side of it, you do want to know for yourself and for other people that there's no forcing someone to talk about it if they don't want to talk about it, because that can kind of make it worse for either you, if you know that you're not it's not helpful to talk about these things, and also for somebody else if they don't want to talk about it, respect that, because it can make it harder for them, particularly like if it's a traumatic experience. But, you know, for a lot of people, it is helpful to talk through and maybe share a story of the person that is told about the death or about positive memories about the person in their life, and just trying to be patient, even if the story is repeated. It can reduce the sense of trauma that's associated with the death. And if needed, like if you're in that period of peak exposure to these traumas, you may, in your workplace or care, you know, in your setting, look at seeing if your psychiatry department can create any kind of ongoing grief groups in your hospital where people can voluntarily go and attend them and get more information.
Yeah, thank you. Thanks. I really want to encourage you in your workplace to establish a grieving group, even if it's only a small number of patients, because, you know, we get very attached to our patients, and a lot of our self-esteem and our sense of ourselves as being able to tackle problems and solve them is really tenuous right now. As physicians, especially in infectious disease, I know from talking with other providers that they are people who are expecting others to come to them to ask for advice, and the advice is very difficult to deliver. We just don't have the answers, and we just don't know what to say the way that we might normally. And so that does generate a feeling of helplessness and a feeling of inadequacy. One of the people we were talking with said it was a sense of impotence. And, you know, we have to really acknowledge that that's what we're experiencing and accept that emotion. So that's really sort of also that middle ground, is being able to say, I accept that I'm feeling this way. And I'm not going to try to push it away. I'm going to acknowledge that this is what's happening right now. I want to go on to this question here about coping strategies, Steve. You talked a lot about that, but what I see in the background is how do we make these strategies work for us, and how can we use them to deal with stress? I know that when you're at a webinar, you hear something, and a lot of times you'll think, that makes sense, I want to try doing that, and then, you know, a few minutes later you're around a staff member and they're coming at you, and you can't remember anything that you've just learned. So if you want to think about some coping strategies and how can you deal with what's going on, I want to encourage you more than anything to try to slow down. Slow down and try to connect with the moment. Because as you connect with the moment, you're giving yourself just a little bit of time to process what's really going on instead of having an automatic response. You know, Steve talked earlier about that desire to be very quick. We're in emergency settings very often. We need to make quick decisions. Physicians have to really think on their feet. But even just taking a few moments, a few seconds to slow down can make a big difference between feeling overwhelmed and being able to deal with things. Another coping strategy that Steve alluded to is the idea of being able to take a break. I often counsel people who are trying to just deal with overwhelming situations to go into the bathroom or the restroom, whatever you call it, and just sit in there for 3 minutes. Now, 3 minutes might not sound like a long time, but the bathroom is like your own private office when you're overwhelmed, and you can put the lid down and sit on top and just take a few minutes to do some of the deep breathing that Steve talked about. And as he said, breathe in and breathe out and let yourself relax and just let yourself let go of some of that stress. You will be amazed at how functional that is and how much it helps. Do you want to add anything, Steve?
You know, I think those are amazing points, and that thing about just slowing down, like that, if you can just take one thing out of this entire webinar, if there's only one piece, I'd say that is the biggest piece, because it really cuts through almost everything that we talked about. That, you know, you're going to naturally want to do this fight or flight response, But as you just said, Deborah, slow it down. Slow down your thinking, slow down your breathing, whatever, but slow down your limbic system so that you can be more attentive to the moment. And that will not only help you in terms of coping. There's problem-solving coping, which is actively planning and figuring out what the best possible solution is. That's hard to do if you're in one of these fight or flight, high anxiety situations. So you want to slow down to be able to do that. And then, again, the other side of it is there's two pathways. You can do the problem-solving coping for things that have that have solutions. But some of the stuff with what you guys are going to be, are facing, will be facing, have faced, there isn't necessarily a great solution, a perfect solution. And that is when, as you say, Deborah, that's when you do the emotion-focused coping or the mindfulness or the relaxation or the distraction, because there's nothing you can do about it. So you just have to, on the slowing down side of it, tell yourself, listen, I've done everything I can. That's all I can do. I'm going to try to slow down, and then take a deep breath and move forward.
Thanks. I'm looking at this question that says, what do we do? This is a tough question. What do we do about burnout, isolation, increased relationship problems associated with telehealth? Oh my gosh, during this pandemic. Well, isn't that the question that we're all asking ourselves? Telehealth, which sounds like a great idea, is starting to run our lives. And, conference calls, Zoom, all of that stuff, contacting us all the time. Now is the time to establish a boundary, right? So one boundary that you need to recognize is that you need a break in between calls, in between telehealth patients, right? There's no way.
I don't mean to interrupt.
No,
but
go ahead.
That one thing, when you're in the workplace and you have 3 meetings back to back, you at least get the break of walking to the elevator, going to the other floor, and going to the next meeting. But if you're working from home, it's not automatic. So sorry, I just wanted to throw that in there.
No, that's fine. The other thing that's important to recognize is that as you do these kinds of telehealth activities, whether it's being on conference calls or talking with patients and having those breaks in between the calls, that you need to recognize that it's possible for work and home to start to blend into one thing. So it feels as if you're never leaving work because your work is at home. And that is really an uncomfortable position. So I want to recommend to you that you think of a few strategies, and I'll give you some ideas. One is that when it's time to start working, you follow a routine. You have a specific schedule. Perhaps you start at 8, whatever it is, and you put on your work clothes. I want to suggest pajamas are not the order of the day for your working attire. Put on some work clothes, start working. When you take a break, try to get outside if it's at all possible. It really, really helps to be outdoors and to get some sunlight because it will help you sleep at the end of the day. When you take a lunch break, take a real lunch break. Step away from what you're doing, go into another room or go outdoors if you can. And at the end of the day, change your clothes, right? Go into your next routine. Put on some clothes to do some exercise at home, or if you can, go outside, whatever you can do. But have that sense of going through those transitions. And at the end of the day, turn the computer off. Do you want to add anything, Steve?
No, it's just what you're saying kind of resonates. We're doing a lot of work from home. I think the audience might be a mix of people who have to go in, and be in clinic for periods of time or be, on service for periods of time versus potentially also doing telemedicine from home. So we probably have a mix, but I definitely agree. It happens myself, I'm on one call and then the other one starts and, just you're sitting in a chair and at least to, stand up or do jumping jacks or push-ups or something to break it up, because that might not be the same as the, anxiety reaction that we were talking about, but it's also not necessarily healthy to just be sitting in a chair all day and not taking breaks, and that's also not great.
I want to just touch on the other two things that are here. One is about isolation, which I think a lot of us are dealing with who are working from home. And that experience of isolation, even when we do these kinds of telehealth interactions, I want to encourage you not to turn the camera off. Stay connected, right? Just seeing that other person can really make a big difference, and try to reach out with other people in creative ways. I played tic-tac-toe, for example, with my grandkids last night. And so it's possible to stay connected in that way. The last thing I just want to touch on is another part of this question. What do you do about relationship issues, that irritation that you bring home? And I know that some people have had concerns about how much can I tell my family about what's going on in terms of my hospital work, my day, and that's really a big topic. So let's just touch on first talking about irritation. It's easy to get irritable and frustrated with your partner when you get home, or with your kids, or even with your dog. And that is that same thing that angry person is experiencing, right? Having it all bottled up on the inside. Talking with your partner is a good idea, but you want to be very careful about talking too much about things that can then traumatize your partner as well. It is possible to transfer that traumatic experience to another person by talking about it, and sometimes it's overwhelming to them. And you are the only person who can really gauge how much to talk to your partner. I think they do want to know what's happening for you. They do want to feel connected, but you have to really recognize that they're not prepared to take on everything that you're taking on. And so there's some conversations it's good to have with your colleagues. Do you want to add anything there, or should I go to another question, Steve?
No, I think that's a good coverage. Thank you. Yeah.
Okay. Our next question is, how do we deal with highly anxious patients and stay grounded? I think that means not lose my cool. Do you want to answer that?
Yeah, I think one thing with highly anxious patients to just keep in mind, those of you who might remember, if you ever took Psychology 101, there's that Maslow hierarchy of needs, and thinking through for your patients, the basic level needs are their safety and their health and things like that, and then going up on the chart is managing different things all the way to feeling euphoric. And, first in traumatic situations, if they're not, hospitalized, but you're maybe doing telehealth with them, or you're doing an outpatient visit or something, first is, of course, assessing their safety, and are they, able to stay safe? Are they, so distressed that they need other services? Or, are you comfortable if they're super anxious and it's needed, either prescribing something for it or referring them to services to be evaluated for, clinical anxiety. There's great behavioral therapies out there that do help with anxiety during times like this, whether it's what we call psychological first aid, or, really treating an anxiety disorder when it becomes really out of hand. So, thinking through things like that in terms of working with patients and helping them through it, and utilizing a lot of the stuff that we talked about today, but translating it to them. So making sure they have social support, giving them tips about unplugging and recharging, making sure that they have positive events happening during the day, making sure that they're utilizing things like relaxation skills. Relaxation, people say, oh, relax, but relaxation is actually a skill that you can learn if you don't know how to relax. There are 20-minute relaxation, I want to say tapes, but I'm going to say digital recordings now, or things like that, where you can, learn And what you learn to do is it takes you through, like, for example, progressive muscle relaxation, has you tense the different muscle groups in your body and then relax them, and actively notice that difference between feeling tense and feeling relaxed. I'm doing it really quickly, but when you go through the tape, the person talks a lot slower and in a more relaxed way. But taking you through this procedure called progressive muscle relaxation is one type. Different people are going to respond to different types. Some people that might suffer with attentional issues might not be able to do a meditation or a relaxation 20-minute thing. But they might find relaxation through, active yoga or mindfulness through yoga or, bike riding or something that's more active. But all these things are useful to help with anxiety, exercise, sleep, making sure that sleep is controlled, things like that. So, there's the advice that you can give to patients, and then there's also staying grounded yourself, but they're the same techniques in terms of managing anxiety, whether you're practicing them and hopefully benefiting from them, kinds of like the things that we talked about, and then also hopefully transferring that knowledge to others.
I wanted to just touch on one last question that had come up earlier, and that was, how do we help people who have been sent home, so people who are quarantined after exposure to the virus, and the way that they're feeling. And this is especially salient for people, who are getting sent home when they're working on the front lines and they feel like they're leaving their colleagues behind. They have anxiety about whether or not their colleagues might have also been exposed. They have anxiety about whether their families will be exposed. And they have anxiety about their own health status. And so it's really quite a difficult scenario. And I want to just take a moment to encourage people who are experiencing that, or people who are working with staff who've been sent home, to recognize, let's say for people who are supervisors, to recognize that their staff want to stay connected. One of the things that you will find that staff will do is that they'll want to call, they want to hear what's happening, they'll want to stay connected with what's going on at the hospital. That's fine. It's normal for them to want to do that. Another thing that they'll want to do is they'll want to really be, taking care of their families. That's normal also. But that's a really good opportunity for people to recognize the limits of what they can actually do. So earlier in the slide, Steve was talking about recognizing that there are some things that you can do something about, and there are some things that you can't do anything about. And really, the wisdom is figuring out what you can do. So in this particular case, if you know everything that you need to do in order to keep your family safe, you've done everything you can. So at some point, you need to let go of the outcome, right? You need to be able to accept, yes, I've done everything that I can, and now I'm going to let go of the outcome because everything that I can do has been done. At some point, you need to relinquish control over the outcome and just let things play out the way that they will. If you're doing the right things, you've done the most that you can. Do you want to add anything to that, Steve? We have a couple minutes and then we'll do it.
No, I know that we want to do the meditation, but another question did come in that is a very, I'd say, not easy question, but I think we should address it, which is our doctors had conflicts about COVID treatments leaving rifts in our department, and how might this be addressed. And, I think it goes back to some of the stuff that you had mentioned about even controlling anger, or when you're seeing people that aren't doing things the way you would do it. And I think for some of this, it really is just going to be that people aren't going to always have the same perspective, and knowing that, kind of trusting that their opinion, even if it's not your opinion, is valid. But you can only, actually even what you were just saying now about the kind of serenity prayer way of doing it, you can only control you in the situation. You can set an example. You can try to not be super anxious or super angry about something, but you telling yourself you can only control yourself in this situation. So it's just like any other medical situation. Like, you have to do the best that you can to try to, if you're working with either a patient or a group of patients, to express your opinion, taking reasonable steps to do so. But if others disagree and it's their patient, like, you have done all you can do. So it is that balance, and then trying to, at least on your side of it, not having that carry into the next shift or the next encounter, because this is going to still be a stressful time. And maybe, when it's over, or at some point when, people are calm, you can talk it through a little bit more. But I think, trying to mitigate the more severe emotional response to these disagreements is going to just be better for you and for the situation.
Thanks.
I don't know. Do you have anything? You might have stuff to add to that.
No, that's good.
Okay.
I want to respond to the last question, and then we'll do our meditation. Someone says, when was the last time you saw a toilet seat lid in a clinical environment? And I thought that was really great. Actually, I work in Africa, and a lot of times there's not even a toilet. So yes, you have to make do. You have to find your place where you can have a little bit of quiet time. And having said that, we're going to make a little bit of quiet time right now. So I'm going to ask everybody to just take a moment, 5 minutes, to practice some meditation. And the technique that we're going to use is a mindfulness technique that Steve was talking about earlier. And so what I'd like you to do is just sit in a comfortable position. I'm assuming that you're sitting somewhere. Sit in a comfortable position and try to sit with your back straight so that your spine is straight up and down like a stack of quarters. And just let your hands rest comfortably in your lap. In that comfortable position, just be aware of the fact that your body is heavy on the chair. And be aware of the fact that your hands are heavy in your lap. Bring your attention to the weight of your body, the weight of your arms, your legs, your feet. And in that comfortable position, take a deep breath, starting with the belly. So bring the breath in through the nose and let the belly expand. You might find that your clothes are a little bit tight, and breathe out, just letting the breath flow out gently. And as it comes all the way out, just push it a little bit more with your belly and breathe in again through the belly. And breathe out, just letting your body relax. And breathe in. Allowing your belly to expand. In this comfortable position, bring your attention to your breath, being aware of the even movement of the breath as it enters the body and leaves. You'll notice that thoughts will come up, but just let them pass into your mind and through, bringing the attention back to the breath. Breathing in and breathing out, letting the whole body relax. Being aware of sounds, air on your face or on your skin, tingling in your fingers, the warmth of your body, and bringing the mind back to the breath. Breathing in and out. Just letting your whole body relax as you breathe out. And breathing in and out. Being aware that if emotions come up for you, thoughts come up for you, don't fight against them. Just let them pass through. Allow the emotion to just relax with you. You might want to think of that emotion as if it were a little puppy that you would cradle in your hands and hold against you. Just letting it soften, soothing it, calming it. Breathing in and breathing out. Being completely present in this moment. No judgment, no criticism. Simply accepting yourself at this moment. And now taking one more deep breath and letting your mind come back, coming back, letting go of these last 5 minutes, coming back, letting your eyes open and rejoining us. We want to thank you all for being here and for taking the time to talk about how to take